Welcome to our podcast, Inspiring Living, with me, Mark Candelaria. I am an architect, blogger, traveler, chef, father, and husband. I'm the founder and now a partner of a fabulous 25-person architecture firm specializing in high-end residential architecture, designing amazing homes across the country. We have hosted tours to Italy, Spain, and now Napa over the last 20 years, and in the course of all this, I have met a lot of interesting people who truly inspire me. Our podcast is about all the opportunities that are right there in front of us to inspiring living. Yes, we will talk about architecture and design, but every week we will venture into all sorts of topics that will inspire you, teach you, and motivate you to inspire living every day. My guests will include a wide gamut of amazing people, from those in the design industry to clients to real estate professionals, chefs, artists, sports figures, and philanthropists, and people who just flat out get it. Sit back and enjoy, and let's have some fun exploring all the opportunities that are there just waiting for us. Please subscribe and get ready to be inspired every week. Okay, as my dad says, here we go. Because Inspiring Living is all about the people and the organizations that inspire us, we are excited to have Monogram Appliances as one of our sponsors. Anytime we do a new kitchen or a kitchen remodel, Monogram Appliances are what we recommend to our client. Their appliances are the definition of luxury, meticulously detailed using the finest materials and an ownership experience that is second to none. This is how Monogram is always thinking ahead and inspiring and elevating the kitchen experience. Because at Monogram, they don't just elevate one thing, they elevate everything. Welcome, everybody. I hope everyone had a fantastic weekend. I know we sure did. We hit the 100-degree mark for the first time today, so actually on Sunday. And so, yeah, summer's here, but I tell you what, I think most of us are happy to see 100 degrees for the first time ever. I think we all have the feeling that, maybe this hot weather will kind of zap that coronavirus a little bit. And I know we're all getting stir crazy. I'm hearing it from all my friends and clients and family. And, I think we all want to get out. And I had a good conversation with a doctor, a client of mine who's a very renowned world doctor. He's from Persia, and he talks to people and doctors from all over the country and all over the world. And his perspective on this was pretty interesting. I'm going to see if I can get him in as a guest. And he's kind of saying, we got to get back to work. This is ridiculous. And I think we all want to be cautious. We all want to be smart. But on the same time, I think a lot of us just are ready. I think we're done. And if we're going to get sick, then maybe we'll be like Boris Johnson. We'll recover and we'll be fine. But who knows? I mean, no one knows. No one knows the facts. No one knows anything. And my guest today will definitely confirm that. She's a medical industry technology expert, and her perspective is very interesting, so stay tuned for that. But anyway, I wanted to say a couple quick things. I want to say thank you to all of those of you who tune into our pasta making class this Saturday morning, 10 a.m. on Instagram Live. We had so much fun. My daughter Tiffany and I made pasta from scratch with our Candelaria collection pasta maker, which you can order online on our website. We've posted the video. We've posted the recipe. It's all right there. And I'll tell you what, it is one of the funnest, most easiest things to do with the kids. It'll burn up about half a morning. And guess what? You get to eat everything you make, which is just the best. And it's the best pasta ever. So just give it a try. You'll see from my video that it's not perfect. It doesn't be pretty. And then sometimes it's actually kind of fun, in fact, if it's not too pretty, because it's just a big mess and you just have a lot of fun making it, and it's going to turn out great. I guarantee it. So if you don't have your pasta maker yet, please order one. You will love it. And just follow us along on our video, and you'll be making and enjoying pasta before you know it. Okay, and then we also want to thank Phoenix Home and Garden Magazine for our beautiful feature of the home in Silverleaf we did with Schultz Development, Earth and Images, Creative Designs and Lighting, Berghoff Design, and so many vendors that helped make that house an absolute success. And it's a beautiful feature, and I want to thank John Rourke again for featuring another one of our projects. And we've got some great ones coming. So between Lux Magazine and Phoenix Home and Garden, we want to thank all of them. And we look forward to more great publications and more features in the future. So enjoy. Have a great week. I hope everybody stays healthy. Hope everyone get outside, enjoy this warm weather, get in your pool, do a little hiking, and let's make the best of it, okay? Love you all. Well, welcome everybody. Today's guest is a strategy and policy consultant in the healthcare industry and a wonderful client and friend of Isabel and I. Today we welcome Pooja Babbrah. Her focus is on healthcare technology and the importance of using technology to help those involved in a patient's care, including doctors, nurses, clinical and administrative staff, and the patients themselves. So, welcome, Pooja, and thank you for joining us on this podcast today. How are you?
Thank you so much, Mark.
Yeah, it's great. I know all of us listening are very curious and trying to get some accurate information about this pandemic. And I know everyone gets different stories and different, access to different data. So it's hard for us laymen out there to, to sort out what's really real and what's not anymore. It's really tough.
Yeah, absolutely. And, there's a lot of information out there. Some of it's good, some of it's bad. And
Yeah.
I tell you, even being in the industry, it's sometimes hard to wade through it. But, there's a lot of great work being done and happy to share with your listeners
Oh,
because I
that's
think
great.
this is actually really timely. So,
Yeah, no, it's perfect. So start to tell us a little bit about yourself and what you're doing now. Give us a little background on you and who you are and why you're here today.
sure. So, as you mentioned, I'm a healthcare technology and policy consultant. I have been living in Phoenix for about 25 years now, and have been working from home. So I work for a boutique consulting company, and we're actually all distributed. We don't have a actual physical office. We all work out of our homes.
So
So,
you're way ahead of the curve.
I was going to say, so when everyone said, "Oh my gosh, I'm going to be working from home now," I'm thinking, yeah, I've been doing it for 5 years. I can give you all some tips on how to
That's
make it
funny.
work. But the thing that's different for us right now is now, our daughters are home. My
Right.
husband, who's usually traveling, is home. So we're figuring out how to make it work.
Yeah.
But yeah, it's been definitely an interesting time, and being in the healthcare technology space, we're seeing a lot in terms of kind of the what the doctors are going through and all of that. But
Right.
we've got a little bit of a unique position in that we can see kind of the data side and the technology side, and
Hmm.
really how things are going to change, kind of given this
Yeah.
emergency we're going through.
Well,
So
you're in the right place at the right time. That's for darn sure. Because I think, like you just said, I think there's going to be so many changes in how medical services are delivered and how we receive them and how we get the access to the data that's correct. Because I think
yeah,
that's one of the big problems that I'm seeing right now is no one really knows what is going on.
it is, and I think that's the big thing that's come to light. And what's interesting, when we go to our doctors today, they're all staring at their computer screens,
Right.
right? I mean, they spend more time staring at that, and you see them kind of making the decisions on their
Right.
their computer. So all the data's there, but what's come to light with this pandemic is that data has not always been easily like an easy way to share that information,
Right.
and especially with the public health entities. So I was actually listening to another podcast the other day, and someone said that, when the CDC released their data in mid March
Mm-hmm.
on the first 4,000 patients, that information was actually, it was based on paper forms that people were filling out. None of
Wow.
the data had gotten there electronically. There was missing data on age, whether or not these patients actually ended up in the hospital, and even if they passed away.
Yeah.
So we're looking at a lot of data that's just not, even though it's there electronically for us, it's not easily shared back and forth.
Right.
And
Yeah.
so that's a lot of the stuff that we're working on with our organization.
Yeah, that's so cool. Yeah, because I think there's so many opportunities to really start, streamlining this and organizing it. So, because this
Yeah,
won't be the first time something like this happens. I mean, I'm kind of amazed it
yeah,
hadn't happened sooner, to be honest with you.
yeah.
Uh, so I think there's some real opportunities to really fine tune some of this whole process. So, okay, let's start at the beginning. You grew up, from what I understand, in Olympia, Washington, which I've never been. I've been to
Yeah.
Washington, but I've heard Olympia is beautiful.
Oh, it is. So Olympia is the capital, and it's about an hour south of Seattle.
Okay.
Smaller town, great place to grow up. And it's funny, I've seen on some of your Instagram stories when you go back to Colorado, and
Yeah.
it actually reminds me of Olympia a little bit. A
Yeah.
smaller town. We knew all our neighbors. We got
Yeah.
to leave our doors open, and so yeah, it was a great place to grow up. And my parents and sister are actually still there, but grew up, born, raised in Olympia, ended up going to University of Washington
Okay.
in
Go
Seattle, where
Huskies.
I go Huskies, yeah, absolutely, and did my undergraduate there and actually had planned on being a pediatrician. So my best friend and I growing up, we said, look, we're both going to become pediatricians. We're going to move back to Olympia. We're going to start a practice. And the funny thing is she actually did that.
Oh,
So
cool.
she's actually, she's a pediatrician to a
See,
lot
you're
of
the
our
one that went
friends back
rogue
in
on her,
Olympia.
huh?
Yeah, I know.
That's
So
funny.
I ended up taking a little bit of a different track while I was doing my undergrad. My dad actually retired from the state of Washington. He worked for the Department of Transportation. And, similar to probably a lot of people, even though he retired, he immediately, got an offer and he moved to Washington, D.C. And
Hmm.
my mom moved to Washington, D.C. And ended up, he took a job out there for a while doing some consulting work. And so I was a junior undergrad, looking to just find a job, still live in Seattle.
Yeah.
And my senior year, I actually got offered a job even before I graduated. So I ended up taking the job, decided I was going to stay there. And it was funny because I believe that things are written for you right in the
Yep.
universe, or there's always
Totally.
signs there, right? And there's always things if you listen. And what happened was it was actually a weekend, and my roommates, they all had family in town. They'd all gone home for the weekend. And I remember I was sitting in the apartment all alone, and I'm thinking, if I take a job here in Seattle, like there's going to be times that I'm just going to be by myself. I won't have any family around. I have friends and all that, but,
Yeah.
trying to go see my parents, it's not just going to be an hour drive
No.
south. It's going to be
Flight
buy an
across the
airline
country.
ticket.
Yeah.
Yeah, exactly. So I ended up calling my parents that weekend and said, look, I'm going to turn down this great job I was just offered and move to DC. And I think they were a little bit shocked, saying, look, we just paid for all this school. Why would you turn down this great job?
Yeah.
But I tell you, it was probably the best decision I made.
Wow.
So, I ended up living in DC for a couple years and then moving down to Arizona.
So what'd you
Where
do
I've
when
been.
you were in DC?
So I worked for the National Science Foundation.
Oh,
So
cool.
we were supporting, grants and things that university students would apply for grants from the National Science Foundation to do research. So I was doing more on the technology, like the database side, but also got involved with some of the students in evaluating their proposals. So it was just really interesting to see the kind of research that was being done.
Yeah, that's very cool. So then, how did you make the switch down to Arizona?
Yeah, so that was also, I always say, was probably written for me. So I was actually getting laid off from the National Science Foundation because they lost one of their big funders, and was planning on heading back to Seattle to do my MBA. I had turned in all my paperwork to go back to University of Washington, and I had actually applied to ASU as just a backup school in case I didn't get back into University of Washington. And they were recruiting minority and women at the time, and I fit those. So they said, "Hey, we'll give you a full ride if you want to come to ASU." So I ended up coming and visiting middle of the summer. Absolutely hated it, to be honest with you. 112 degrees.
Oh
I'm
my
walking
God.
around campus, but
Yeah.
I was like, I can't pass up a full ride. So
So
I ended up moving.
had you been to Arizona before?
I had been once,
Okay.
and at that time it was spring and it was beautiful,
Yeah.
and it's kind of the weather we been having the past couple of weeks. But this time it was a little different, and I thought, it's fine. I'll just put in my 2 years. I'll be out of here. I'll go back to Seattle or go back to DC. But ended up actually meeting my husband. I think the second day that I was down here after we moved
that's
down.
cool.
So ended up being here and have been here ever since.
25
so
years.
25 years.
Wow.
Yeah.
Yeah, that's amazing. So you went from being a Husky to a Sun Devil.
I did. Yep.
And from there, then what did you do once you graduated from ASU? You got your MBA. Is that what you did?
I did. I did my MBA, and actually, so ended up still in the healthcare field. And it was actually during my last semester that I did a project for a health system here. It was actually St. Joe's back in the day, and just absolutely fell in love with healthcare and decided that that's where I want to put my focus, even though I ended up not doing the clinical side,
Right.
but took my kind of technology background that I had and paired it up with healthcare and ended up working for which is now Banner Health. It used to be Lutheran Health Systems,
Yep.
for those that have been around in the Valley for a while, and ended up working in their strategic planning department, and then from there kind of getting onto the product technology side.
Interesting.
So that's how, kind of my career took a little bit of a turn.
Yeah. So are you like a computer wizard then? I mean, you understand systems and programming and all of that stuff.
My undergrad was more, I mean, I do, but more at kind of the business level.
Mm-hmm.
Like I had to take coding classes, but I would never be able to do it today.
Yeah.
But I always say that I can, like, when I was a product manager, you're more on the business side, but you had to work with the technology people. So I could always tell when they were BSing me about
Interesting.
something. So
That's
yeah,
good.
I could all be like, okay, I know that doesn't make sense.
Yeah.
Even though you're telling me it's going to take 6 months, I know it's only going to take, a month
Yeah.
or two. So I know enough, but definitely more on the business side of it.
Yeah. So more on the logistics side and the organizational side and how the systems work and all of that stuff.
Exactly.
Interesting.
Yep.
Yeah. That's
And now more on the kind of the strategy side of how do you use
implement
technology. Yep.
and implement that
Exactly.
technology. Very,
Yeah.
very cool. Um, so how has this whole COVID-19 impacted your work and your efforts to ensure that healthcare information is shared quickly, accurately, and securely? We talked about it a little bit at the start of this podcast, but what are you seeing? What are some of the things that you see happening with all this?
Yeah. So, as I said kind of in the beginning, I think there's been a couple things that have happened. One is just we're realizing what big gaps we have.
Right.
As I said, we have all this data sitting there that should be easily shared with public health organizations, with, between hospitals, between health systems, and it hasn't happened today, and that's been a big issue.
Yeah.
But then it's also bringing to light technology that's been around there for a long time that just hasn't really been used. So, a good example is telehealth, right? I mean,
Right.
there's been telehealth companies that have been out there and, mainly focused on kind of the rural areas. But now, I mean, like we had a telehealth visit the other day. I'm sure others, have had them as well. And part of the thing is, it's not necessarily the technology that stops things. A lot of times it's the business side. And so part of the reason that doctors haven't implemented telehealth in the past is they were not getting reimbursed. So they couldn't bill the same for a telehealth visit as they could for a patient coming into their office.
Wow.
And what the pandemic has done is all of a sudden Medicare came out and said, any doctor that wants to see a Medicare patient using telehealth, we will reimburse you for the same amount as that patient coming into the office.
Yeah.
And so that's really changed kind of a lot of people's view on telehealth. And so people always ask kind of the next question, right? Is that going to stick around? And honestly, I think it will.
Oh, I totally think it will.
Yeah, I think it will. But, the other side of it, which another thing that I don't think people realize is a lot of physicians make their money also, though, from like that giving vaccines and things like that. And so if they're not getting paid for some of those services, a lot of the smaller guys are really going to struggle with this telehealth. So there's kind of both sides of things.
Yeah.
So it will be interesting to see. I think there definitely will be more people who are using telehealth, but I think you're also going to have those patients that are clearly going to have to get back into the offices.
Yeah, but I think I would say, thank goodness, 90% of the time I go see my doctor, I'm actually just fine. I'm just getting a checkup, or I've got this, or something, something minor. But I know when I walk in the door, it's even before this whole pandemic, and I'm not even a big germophobia person, but I'm more so now than I used to be, of course. But my biggest fear was always just going to the doctor's office and like, am I going to walk out with more than what I walked in with?
Yeah, exactly. Yeah, definitely.
So
and,
it kind of freaks you out.
Yeah, and people that have chronic diseases, someone that has diabetes or something where, the doctor just has to lay eyes on that person at least once a month, you could easily do that through telehealth as opposed to having that person go in the office. So I think there's going to be a lot of changes that way.
Yeah, especially for the elderly. I mean, I think of my mom and dad, and they live down in Maricopa, and same thing. It's like, I think if they could just do it online and feel safe, I think that's just so much better for everybody. And if you think from the insurance standpoint, it's got to be saving people money because
It,
they're not getting
yeah.
sick more by going to the doctor's office.
Exactly. Yeah. I mean, it definitely helps all around. So I think that's definitely something that's come out that will actually be a positive out of all this, along with the need to and the kind of infrastructure we're now putting in place to be able to share
The
information with
data, yeah.
people,
Because I wonder,
which is
I
another
don't
thing.
want to get too political on all this, but I
Yeah.
just
No.
wonder how much of the data is being, manipulated in a way to promote one's political, side than from the other. And it's like, just give us the facts. We'll sort it out ourselves.
Right.
And
Right.
that's what
No, and
frustrates me.
that's a really good point. And I think people also don't realize that how difficult it is to get your own kind of medical record. And,
Hmm.
I know you and Isabel went through
Oh,
a
yeah,
big thing
yeah,
recently. And, you listen to some of the CEOs and even the head of, the Health and Human Services in DC who said, we've had some pretty major diagnoses. And I was trying to, he was trying to get his own record and he
right.
couldn't get his own medical record. And so some of the work that we do is around just even you as a consumer taking more control over your own
Sure.
information
Yep.
and making sure that you can get that, which is another thing I think we're going to see coming out of this
Yeah.
pandemic.
Yeah, totally. Because like, I think about my own, and it's just like it's all over the place. It's like
Yep.
I can't remember when I had this, or where's that, and where did I
Yeah.
do this, and yeah, it'd be nice to have it all streamlined, where I could just hit a button, and there's my whole history right there.
Yeah, and actually, so that is one thing that we've been working on, and something. So if you have an iPhone today in your health app, and I think a lot of people don't realize this, you can actually download your health records
Hmm.
to your iPhone.
Didn't know that.
And yeah, so you click on that health app, you click on medical records, and if your doctor, and I think probably about 50-60% of the doctors are now connected, and it's going to be mandatory starting next year. You can download everything to your phone.
Wow.
And, that's something that we're really pushing now from a just advocacy standpoint of download your record so you have that information and it's easily accessible.
Right.
So,
Oh, that's great. Especially, I mean,
yeah,
I would also think that, like, if I mean, we all have our phones strapped to our bodies. I mean, if
exactly.
something happens to you, it sure would be nice to have it right there, where either
Yep.
your spouse could get at it, if you're unconscious and incapable of doing that, but have it just immediately available would be so beneficial, I would think.
Yeah. Oh, absolutely. And it's sad that people don't realize that's
Huh.
a feature that's available. We're all wrapped up in it. So we're like we did it the first day that it came out. It's been out for probably about 4 months
Yeah,
now.
how come
Um,
they're not promoting that or letting people
yeah.
know? It's funny.
Yeah, it is. It is. And so I'm glad to be able to share that
Yeah.
information to your listeners.
No,
So
that's great. Uh,
highly recommend people
Another
do
thing that
that.
we're starting to talk about with my team is, eventually we're going to be going back to the office, and we're trying to, well, we're doing, and it's easy for us to work from home, so we're going to extend whatever they say. Like if they say we have to be back June 1st, we're going to push it out to July 1st or whatever. We're going to take an extra
Yep.
month and just let other businesses kind of be the guinea pigs of what's working and what's not
Right.
working, and okay, that didn't work so well, let's definitely don't do that. Or what are
Yeah.
some of the things that you're seeing or hearing that, just for instance, our office, you've been to our office.
Yep.
uh, I mean, what are we? I'm kind of saying, well, do we have to all wear masks every day? And do we do, instead of meetings in our conference room, do we just keep them all Zoom meetings and go to meetings and not have clients coming in? Because, I mean, how do we know if a client is sick or not?
Yeah, exactly. And it's going to be hard. And I think that's and what we're finding, especially kind of in the health technology industry, is we're seeing things canceled through September
Yeah,
at a minimum right now. And, people are saying, well, it's working for us to be home. So why not take a little bit longer just to make sure,
right.
let them more data come out. Let's find out a little bit more. And I think it's really kind of a personal thing, right? I mean, if you're
Sure.
comfortable and I think it's those businesses that are going to kind of give that flexibility, I think is really important. And we're starting to see that in the companies we work with where people are saying, look, we may open up, but if you're not comfortable coming in, we're okay with you working from home.
Yeah.
But personally, just from our family standpoint, we have my mother-in-law who lives with us, who's
Yeah.
85. And so we're taking the same thing, even if it opens up, we're saying, we're still going to take those precautions. We're going to
Yeah.
wear masks. We're not going to expose ourselves
Yep.
and I think it's really kind of a personal choice
Yeah. I think
at
we're
this
just trying to
point.
err on safety and being,
Yep.
extra cautious. I mean, we started working from home about a week and a half before they even started telling us to do so. I just started watching
Yeah.
everything. I was like, we can do it. Let's get ahead of this curve and start
Yep.
figuring it out now. And what we've walked away from is, I think we're going to have to look at the numbers, but I actually think we've been more efficient working from home than we have at the office. I think there's so many distractions at the office. I know there's distractions at home too. I mean, some of
Right.
my employees have small kids, and that's tough. Or
Yeah.
or three kids in school, and mom or dad's got to be the teacher for a part of the day. So there's all these aspects that we don't all simultaneously experience or see, and so
Yeah.
it's just different for everybody. And like I said, I'm fortunate that we can do it. I feel so bad for all the restaurateurs and
Oh,
who
yeah.
I
It's
know you and
tough.
Bobby and I, we all enjoy that. We all enjoy going
Yeah.
out to dinner and having fun, and it's gonna be tough for those guys.
It is. It is. And, every time I'm trying, I'm sure you guys, I've seen, you guys as well, that we're trying to support some of those,
Yeah,
local restaurants that we've been going to, but it's hard, and there's times when I think I want to go get something. And then I stop myself because I'm like, do I really want to expose
I
myself?
know.
So it's always a struggle. And,
Yeah, because
I think even when it opens back up, being really careful.
right.
So
I mean, they hand you something out the door, but you really don't know what's going on behind the door.
exactly. Yeah,
It's like, well,
exactly.
did that guy was that guy sick? That just packed
Yep.
my food. I mean, who knows?
Yep. Yeah.
So the whole thing is just it's so hard to gauge. And the other thing I was wondering with your technology ability, I was listening to CNBC this morning, and they were talking about all the cases in New York and New Jersey, for instance, versus, let's just say, San Francisco. And I know San
Yeah.
Francisco, they isolated people rather quickly, and I
Right.
think that probably had some impact on their reduced numbers. But what I was wondering is, I mean, everyone that gets on a plane, there's a record of who got on every plane. I'm pretty sure, right?
Yep. Yep.
I mean, wouldn't it be easy to go backward and just kind of reconnect the dots, going in reverse, and just see where people came from, and kind of let the computer study the I don't know what you call it, the steps.
Yeah, like the trans. Yeah,
Yeah,
absolutely. And I think I've seen a couple charts where people have done that, and then all of a sudden people just, the whole privacy issue, right? Like, why
yeah,
are you tracking me? But I mean, honestly, the kind of statistics I've been reading, the reports. I mean, we are going to need a really robust tracking
that
system.
was my next question.
And yeah, one thing that so Apple and Google announced that they are going to work together to do something. And again, questions about privacy came
Right.
in, but my understanding of how this is going to work is it's going to be through kind of phone to phone, so there's no central database that's tracking.
Mm-hmm.
But if you opt into the service and say, for example, we're at a restaurant, you guys are at a restaurant, our phones are close to each other. There will be some kind of tracking mechanism that if one of us goes and gets tested and we're tested positive, that could be sent to everyone that was in that location's phone to say, oh, by the way, someone at this location tested positive.
Hmm.
And to me, kind of having that ability to be able to for someone to alert me, just like we were talking about, right? If we
Yeah.
go to a restaurant, we don't know who's tested positive.
Right.
So a couple of things would have to be in place. One is, full on testing. So everyone would need to get tested, but
Right.
then also people actually opting into this. And I think, in some countries you're able to do that. And then in others, people are not willing to do that. But, we all have our cell phones.
Yep.
And if there's a way to do it, and, we've been working with Apple and Google in some of the work that we're doing. And I know everyone kind of looks at them as the big bad guys, but, there's really some good work that's being done
Yeah. No,
on the healthcare technology side from these the technology folks. And now's the time for people to say, okay, I'm willing to do this to kind of get back to some normalcy. So
right. So one of my questions, and I haven't studied enough on this, so it's probably not going to sound like too smart of a question, but if you're diagnosed, or let's say you test positive for coronavirus, but you have no symptoms, right? You
Yeah.
and so does that mean you'll just infect people forever, or does what does it mean? Like if I
You
tested
know,
positive for coronavirus, but I've never felt sick,
yeah.
and I'm walking around with my Apple phone, and everyone's like, "Oh my God, there's Mark. He's got the
Right.
coronavirus." I
Yeah.
mean, what am I supposed to do? I mean, I'm not going to be able to do anything.
Right. And well, the one good thing is there's no, I'm sure people could hack the system, but they wouldn't know that you had tested. It would just be kind of in general someone in the area.
Yeah,
But I think that's still a question, and I don't think that has
I don't
been
think they know,
fully
do they?
figured out. Right? Is
Yeah,
what we could all be
yeah.
carriers, and what does that mean? Do are we always gonna? And unfortunately, because this is so new, I don't think even the scientists that are studying
They
all
don't
this
know.
know for sure.
Yeah, okay.
So we're just too early
Yeah,
to
I was
know
wondering
any
if
of
I just
that.
wasn't figuring it out, or if people
No,
just don't know yet, and
don't,
I just don't think
at
they
least
know
from what
yet.
I've read, it's they still don't know for sure.
Yeah.
So
So this is the first summer I think everyone in Arizona is really glad to see 100-degree temperatures next week.
yeah,
I mean, we're like,
yeah,
okay, let's get rid of this thing. And they're still not
right.
they're still not proof that that is actually working, but I mean,
No,
it sure can't hurt. Let's just say it kills pretty much everything I've ever seen living here for my 30 years. So
yeah,
I think
yeah,
there's a good chance of that. But then, September, October return, and we have our Italy tour in October, which
right.
for all technical purposes we canceled, but we just kind of I think I'm just being optimistically hopeful and with the spirit of helping my friends in Italy that we could still go, but I think the
Yeah.
chances of that happening are pretty slim. I mean, what's your thinking on the possibility of this having a boomerang effect and being back here in September again? We have to do this all over again.
Yeah, I mean, just from what I've read, I do have a feeling that that's going to happen.
Yeah, I
And
do
we're kind
too.
of watching it from our kids' standpoint, right? Because we've got, our older daughter who is just finishing her second year at ASU, and our younger daughter who's supposed to start in the fall. And we're kind of watching it from that aspect of, are we going to actually send them to,
Yeah, no, it's
on
crazy.
campus if it opens? And, I'm not willing to say that I'm going to let her live in the dorms anymore. And,
Right.
just all these questions. And I think that is a big question that is outstanding. Gut feeling. I always kind of go with my gut feelings,
Yep.
but my gut feeling is we are going to see something come back again, and we're all just going to have to be prepared to kind of go through these cycles of kind of being at home again
Yeah.
until they get a vaccine or some,
Yeah, and
figure something out.
the vaccine is not a sure thing, and everyone says, well, it's going to come eventually. Well, how do you know? They don't have a vaccine for AIDS.
Right? Yeah.
It's like they
Yeah.
don't have a vaccine for the cold. You know,
Yep.
so and every year we get a different flu strain that we have to get a different flu shot for. So I
Yeah.
guess that my question is, there's always going to be something, right?
Yep. Yep.
And so part of it is the way we live and the way we interact, and yeah, we need to clean our act up. Pardon the pun. Uh, but the other statistic I've been seeing, and I sent this to you, is on a given month, about 220,000 people die in this country every month from something: car
Right.
accidents, the flu, gunshots, whatever.
Yeah.
And some of the figures I've seen that the number in March was pretty much the same. Now you could attribute to that people aren't driving around; they're not sitting in bars getting shot, and all the crazy other
Yeah.
things that happen. What's your feeling on all that? Do you think the number? Do you think that there is always something that gets us, and yeah, we just got to be more careful, and I don't know.
Yeah.
Is it nature's way of just thinning the herd? Because I mean, we got, in my opinion, too many people on this earth as it is, and it's just you can't keep everyone perfectly healthy in the situation the world's in right now.
Yeah, yeah. And, I have seen a lot of that. And I think, we will get to a place where we say, okay, this is going to be something that's going to come back every year.
Yeah,
And we're going to have to just figure out how to work with it. But I guess when I look at the statistics, I think it was just the way it ramped up so quickly
yeah,
and how quickly it was spreading.
yeah.
And we just don't know enough about it yet. I mean, the flu's been around for a long time, so we know what to expect. This
Sure.
one, I think it kind of hit us all at once, and
Yep.
maybe there was a little bit of a overreaction, but then on the other hand, you say we just didn't know enough
Right.
about it,
Yeah. Are you willing to err on
as
under? Are you willing to err on underreaction? I wasn't.
exactly,
I
yeah,
told my
yeah, I
employees.
wasn't,
I told my
yeah,
employees,
we
you go
weren't
home and
either.
work from home.
Yeah, exactly. And I would rather, people say, well, oh, it wasn't as bad as we thought it was. Well, that's because we're all home. And
Right.
yes, of course, we have to look at our economy
Yep.
and we will have to eventually balance that out. But I think as we start to get more information and a better understanding of what we're truly dealing with,
Right.
that's going to kind of help us say, okay, next year when it comes around again, hopefully we won't have to lock down. Hopefully we'll kind of know how we can take
Right.
care of it.
Well,
So,
I think some
and
of the. Go ahead.
I was going to say, and the healthcare workers will be more prepared as well,
Yeah.
right? So partly it was the infrastructure, the healthcare infrastructure of just not having enough equipment and things, and
Right.
that's clearly going to change after this. So.
Yeah. Yeah. I remember when it's probably late February or something. I was on eBay or Amazon or somewhere because I was watching the thing in Wuhan, and I'm like, maybe I should just get a box of masks just to be safe if this thing
Yeah.
comes over here. And even
Yep.
by then, they were like $250 a box or something. Like, what? I'm
Yeah.
not spending that much for those. Now, of course,
Crazy.
heck, I didn't know a roll of toilet paper was going to be $250 either. But
I know.
the whole thing is
Yeah,
just
no
insane.
kidding.
And then like what oil is now negative $17. Look, they'll pay you to
Yep.
take oil.
Yeah,
So
exactly.
everything's really pretty much turned upside down. And
Yep.
I just think the opportunities, though, are just enormous in
Yeah.
terms of, how do you make people feel safe? How do you track them? How do you, because I mean, you've got high school kids, I've got high school kids. I mean, they want to go to concerts again. They want to go to sporting events again. They want to go to college.
Yep.
But how are you going to do that, safely, I guess, is the big question. And I'm not an alarmist. I just think the opportunities to do some of the things you just talked about are just huge.
Yeah, yeah, definitely. And I think, everyone's kind of talking about this. We're not going to get back to our, like, what we, how normal life was,
Yeah.
right? And it's like 9/11. We are now all used to going through all the security at the airports.
Right.
Now maybe it's going to be wearing masks when we go to the grocery store for a while, or,
Yep.
doing things like that we just, weren't used to in the past. So,
Yeah. Well, I was just wondering what the airline, situation is going to be like when you go through TSA. I mean, are they going to have to do a nose swab or temperature
yeah,
check or? I would think.
yeah,
I mean, I don't know how the airlines are going to deal with this. I don't. I have been watching that real carefully because I've got a couple clients that are actually CEOs of 7 airlines. I have one client, and it's like, oh my gosh, can you imagine trying to
wow.
adjust your business model? I mean, a restaurant's one thing, but a jet,
Yeah,
you
yeah.
know?
Well, and Bobby and I were talking because we both travel a lot.
Yeah.
Like even the airlines. But then once you get to a hotel, right?
Yeah.
Like
Who's been in their
just kind
hotel?
of everything, right? Yeah, exactly. So
Yeah.
it'll be interesting
Yeah,
to
it's
see
gonna
how this all
a
plays
lot of
out.
adjusting. Yeah, we're thinking of going up to Oregon in July, and we'll probably drive up there. But
Yeah,
like you said, we can't drive there in one day, so we have to stop in a hotel somewhere if a hotel's even
yeah,
open,
yeah.
or say, do we just bring our camping gear and camp
Right.
somewhere? You know.
Exactly. Yeah.
So yeah, it makes you think about everything, and obviously we were all taking so many things for granted in our lives
Yep.
before. Uh, and so I think it's a great awakening to a lot of us of how special just a hug and a handshake was. That
Yeah.
you think twice about it now. It's kind of sad.
Yeah, yeah,
So
it is. And it took us, a week or so. We were doing walks in our neighborhoods, and
yeah,
usually when we go out in the evening, we give everyone hugs, and we would
right.
start kind of heading towards each other, be like, "Oh wait,
Mm,
no, we can't do this
I
anymore."
know it's
Yeah.
awful, isn't it?
So now, yeah,
Yeah. So another amazing role that you hold, and I've followed some of this on your Instagram or Facebook, or whatever. I just think it's so cool. Is you're on an advisory board for Water First International, which is a Seattle-based nonprofit, right?
yep,
Which has led you to Ethiopia and Honduras to helping communities struggling to get fresh water. Now, talk about you know things that we take for granted. I mean, we take that for granted so much. I mean,
oh
we're
yeah,
like the 1% of the 1% that can turn on a tap of water and get decent water. You know,
yep.
but so tell us a little bit about that.
Yeah, that's absolutely right, and it's funny because I used to do education at schools, and I would say, you wake up in the morning, you walk into your kitchen, you turn on your tap, and
Yeah,
you're able to drink water.
or take a
Now
shower.
imagine, yeah, or take a shower, or wash your face,
Yep.
brush your teeth. Now imagine you're waking up, you're walking 3 miles, carrying your water on your back, then bringing it back, and then you can do those things.
Right.
But Yeah, so it actually started. So our older daughter, when I think she was like 10 years old, she had a really bad stomach flu and ended up being dehydrated, ended up in the hospital for dehydration. And, it was one of those situations, right? When the kids are little and, they have a stomach flu, you're calling your doctor, they're like, oh, as long as she's, taking a little bit of liquid, she should be okay. But unfortunately, she got to that point where we ended up having to admit her in the hospital and she had to be treated for dehydration. And, for me, that was just kind of this, awakening moment of, oh my gosh, like if we did not have a hospital down the street that I could drive her
Yeah.
to, who knows what would have happened.
Yep.
And so just a couple weeks prior, my sister had posted something about a charity she was, going to go to an event for. It was called Water First, and so I immediately got on the phone with her, and I'm like, okay, something's going on. I got to clean my karma or something
Yeah,
because
that's good.
Sierra's like, ended up in the hospital. She's like, oh yeah, just check it out. Here's the organization. So I called them and I said, hey, I want to do something. What can I do? And they said, look, we have all these different ways you can fundraise. And one of them I thought was so great. It was a walk that you could do where people actually kind of experience what people in these countries have to do to get water. And so you host a 5K walk and people get those jerry cans and fill them up with water. And they try to walk the 5K like people do in those countries.
Every
and
day.
so every day. And so we hosted one and, kind of got my daughter's class involved, got our younger daughter's class involved. And so I hosted one of those, I think it was back in like 2010. And we ended up raising, like $8,000 for the organization, ended up doing a lot for them in terms of raising money.
Mm-hmm.
And just started to learn more about them. And then a couple of years into it, I kind of kept hosting smaller fundraisers. And I got this email from them and they said, and it was funny because I had never met actually the people that were running the organization. I was just kind of doing this out of, things that I had seen and people that I spoke with. And they sent out an email saying, we do these tours every year to Ethiopia. Why don't you join us? And I thought, I've been raising all this money for this organization. I should probably actually go and see where this money is going. And so I ended up going on the trip to Ethiopia with them, which was amazing. I mean, I tell you that it completely changed my kind of
perspective,
everything. And, the people down there are just amazing. I mean, they had nothing, yet they were just kind of opening up their doors saying, come sit with us.
Yeah.
But the day that really made an impact for me is we were going to a community that we were actually going to be funding a project. And the thing with Water First, there's a lot of charity organizations that do things around water. But with Water First, they try to work with the community to make sure that they're actually having the community do the work. So they don't bring in the people from the outside to do the work. The community members have to do the work. They're the ones that are maintaining it. Exactly, like Habitat, where the families are involved.
They take pride then. They own it.
Yep. They own it and they learn how to maintain it.
Yep.
And they even ask people to like pay, what little they can, pennies or whatever. But
there's some value to it.
Which exactly, and they've got skin in the game then, right? To make sure that it's maintained. And so we were going to this community to let them know that, we were going to be working with them. And we got to walk down to their water source and actually see how these women were collecting water. And it was this tiny little, dirt filled. There were animals all over it. And there they are scooping the water in their jerry cans. And a couple of us went with, different mothers and their daughters. And these women, they walked uphill. They walked the 3 miles. We did the same thing, carried water with them. And just, heard these stories. This woman, had a couple of her babies actually pass away from, dirty water. And so it was just incredibly eye-opening to kind of see that, experience it, and then be able to just say, look, we're going to be able to help you get funding. So, it's
awesome.
I think we do take a lot of that for granted where we're at, especially here in Arizona with all our golf courses. And, there's just, I feel like we waste so much water, and until it's gone,
You don't
you just
realize
don't
it.
appreciate it. You
Yeah.
don't realize it. Yeah,
Well, it's like everything we
absolutely.
talked about. It's a handshake. You don't realize it till it's gone, and
Yeah,
then it's like, oh God, I used to love just shaking your hand. And
yeah,
so, and that's why I think what we're all dealing with the COVID-19 and being homebound. It's like it's not, it's nothing comparison to what you just described in Ethiopia. I mean,
yeah,
yeah, it's
yeah,
tough, whatever. I'm looking at my pool right now. It's full of water. I'm looking
yeah,
at Camelback Mountain. It's a sunny day. I mean,
yeah.
life's pretty darn good despite what we're having to deal with.
Yeah,
So,
and if you think about it, this really affects those people that don't have clean water, right?
yeah.
Because part of the program, when we put in, when we go down and we work with the communities to do the water systems, we're also doing an education piece of it where
Yep.
we're saying, okay, now that you have clean water, start washing your hands and
Right.
start taking baths and things like that. And all of that, right, plays into the whole COVID. I mean, if you don't have
Exactly.
clean water to wash your hands, then it
Yeah,
just,
that's why I've been
if
wondering
it spreads.
how it's affecting some of those countries, and you really don't hear
Yeah.
much, but they probably don't even know.
They don't. They
We're
don't.
never
And
probably never going to hear about it.
yep, exactly. And
So,
I've been kind of watching our communities of Water First, and one of them is in. They're actually going door to door and passing out, basically flyers and doing that re-education of,
hmm,
we have this clean water now. Make sure you're washing your hands. So,
right.
those communities are lucky, right, because they have
Yep.
that clean water, but there's so many that don't.
Yeah,
So,
and there are so many, right? I mean,
yeah,
it's not just
yeah.
a few. That's a lot.
Oh, there's a lot of areas
Yeah.
that still don't have that clean drinking water, or clean water to even wash their
Yep.
hands with. So
Yeah, that's exactly right. And I have one of my friends that's been helping the Navajo Nation here in our own state, and
yeah.
they're struggling there pretty bad with
Oh
some
yeah.
of these same
Yeah.
issues. And again we
Yeah.
take it for granted, and they're only a couple hundred miles away.
Yeah, that's one thing as I started kind of getting more into this is you realize, we always kind of focus on international, which we
Yeah,
should be doing, but
yeah,
then in our own backyard, you have people in the same situation. So
right, right.
there's definitely some great organizations locally that are helping with that
Yeah,
too.
no, that's great. So I know you're an avid hiker and runner. How did you get into that? Tell us about that a little bit.
I am. So actually, it was funny that so we were living in Gilbert. This was, gosh, a long time ago. We were driving back through Tempe, and all of a sudden there was all this traffic jam. We couldn't figure out what was going on, and I stopped and I looked and I saw these runners and realized it was the Ironman triathlon
Yeah.
that they host in Tempe. And I'm looking at these runners and I'm thinking, okay, these guys have, they've already swam God knows how many miles. They've already biked 100 miles, and now they're running a full marathon. If they can do that, I should I should
I should
quit
be able
being
to do
lazy,
the
and I should
marathon.
I can just do a half marathon, right?
Yeah.
Like that's doable. So I actually ended up signing up for the P.F. Chang half
Uh-huh.
marathon. Ended up doing that. Ended up actually doing a couple of sprint triathlons. So the same kind of biking, running, swimming, but on a very, very scaled back scale. And then did another half marathon. And just, I find running very therapeutic for
Yeah.
me. I actually started running in college as a stress relief.
Yep.
And so I end up kind of using it as a meditation
Yeah.
stress reliever. And so, started doing that. But then, the last time I did a half marathon, I ended up the last, I think almost 2.5 miles, I literally cried the whole way because my hip was hurting so
Ugh.
badly. And it actually hurt more to stop and walk than it did to
Just to
just
keep
keep
running.
running. So
Wow.
I'm like, I'm just going to keep going. But it was after that I realized I needed to do something a little less
Yeah.
kind of harsh
Well,
on
I'll tell you a
on
little
my
story.
joints.
Yeah, my dad was an avid runner. I mean,
Yeah.
we used to, we live in Colorado, and he'd run up Wolf Creek Pass.
Oh, wow.
And
Yeah.
it's just crazy. And both his hips replaced. He can hardly walk at all now. I mean, he's
Yeah.
85, but Yeah, it's that is hard on your body long term.
It's
So
very, very hard. So then I took up hiking and ended up kind of, and it's funny, I'm not like an athlete. I mean, you've seen me, right?
yeah,
Like
you're
I'm not
pretty
like a,
athletic though.
yeah, but it's just like, I just enjoy, I'm like, even though I'm slow
Yeah,
and I'm always the last person, I'm like, I just, like, I enjoy getting out
that's
there
how
and
I am.
doing. So, yeah, so we ended up, and then I started hiking. I signed up for like the Seven Summit Challenge. I did this 52 hike challenge where you try to do a hiking trail every week. And then I signed up for the Grand Canyon Rim to Rim,
Yeah,
just kind of
that's cool.
totally on a whim, which it was funny because a friend of mine posted on Facebook and I was like, oh, that sounds fun. And then I signed up and then afterwards I was like, oh my gosh, what did I just sign up
Yeah, well,
for?
I've hiked
But,
down. I've never hiked rim to rim, but I've
oh,
hiked
yeah.
down, and just hiking down was tough. You think
Yeah, but
going
isn't
down
it
is easy, but
amazing?
but my
Oh,
it was
I,
harder going down, I thought, than it was going up.
it is. It's hard on your knees.
On my
Definitely hard
knees,
on your
yeah.
knees. Yeah, yeah.
So you
But
did rim to rim in one day.
I did. So we started
Gosh.
on the north end, like at 3 in the morning, and you go down, across,
What
and
time of
back
year?
up. We did it in October,
Okay, that's pretty
actually.
good.
So yeah, so they only open it from October. So the north end's open. They close it in October, right?
Yeah,
And then they reopen it. So I think we got in right before they ended up closing it.
gotcha.
And I mean, I don't recommend it. It was, very. I trained a lot, and it still took me. My friends I were done in like 7 hours. I think it took me more than 12, but
Wow.
I always say I'm glad I did it. It was great, but I was kind of on this mission to
Yeah.
kind of get through and get to the end.
Yep.
So I was lucky to be able to go back on my 50th birthday, and we ended
That's
up
good.
getting a couple of rooms down at the bottom. So a couple of friends of mine and we ended up getting a couple of those dorms that are down there at Phantom Ranch,
Yeah.
and went down for my 50th birthday where we could actually go down and spend the night as
No, that's
opposed to
nice.
just kind of going through. And that's amazing when you're down there. I mean,
It
you want
is.
to
I've
talk
done it.
about kind of the beautiful universe that we're
Yeah.
in, like
Oh, the Grand Canyon is
amazing.
amazing. I mean, it's just
Yeah,
incomprehensible till you do hike until you hike it. I mean, I've flown
yeah.
over it and you can't comprehend it, but when you hike it, you physically feel the vastness of it and the depth of it.
You do. Yeah, absolutely. And especially at the bottom when you're looking up and just thinking, oh my gosh,
Crazy,
I
right?
actually did that. It is.
Yeah, it
It
is
is.
crazy. So,
Yeah.
you obviously are very busy. You're very driven, which I love that about both you and your
Yeah.
husband. And you
Yeah.
have two lovely daughters. So, besides the hiking and running, what else do you do to balance your life?
Yeah. Well, I don't think of my life as ever in balance,
We're
which
all
is,
trying,
I don't know,
right?
kind of right. Yeah, exactly.
Yeah.
We do spend a lot of time as a family, especially now these days, but
Yeah.
we try to. I think, many years ago, I found this kind of concept of minimalism, right? And people always laugh at me when they're like, you were definitely not a minimalist. But when I look at, the things that I do, I purposely do those things. Like I curate what I want to be doing.
Yeah.
And so, for our downtime, like I love to just lay on the couch and read a book,
Yeah.
or, just spend outside time just at home sitting outside. I mean, there's things that we choose to do. And, there's things that we have said, you know what, we don't enjoy spending time doing that. So we're going to cut those out of our lives.
Right.
So, we definitely spend some weekends where we're out and about doing stuff, and then others where we're just like, we're going to stay in our pajamas like all weekend long and
That's
just
easy to
not
do
do
these days.
anything.
Yeah.
Yeah, it is. It is
So yeah, a couple
definitely.
years ago, we did a major remodel on your house, and Isabel did the
Yep.
interiors. I did the architecture, and
Yeah.
Vivian was a big part of helping us through all that. And I bet
Yep.
you're glad that house is done now.
We were just commenting on that, and we were saying, now that we're home and we absolutely love it, and with your team, and then Isabel and Nika and her
Yeah.
team, and like I truly feel very blessed that we've got this space that we just absolutely love, and just fits our lifestyle, and
Yeah. Well, you're in a nice
fits
spot
what
there
we
too.
need.
And
So yeah.
I know we've been trying to schedule us cooking together, and obviously we just have to wait till we can do that. But I'm sure looking forward to doing that someday with you.
Yeah, absolutely. And, we've actually been using this kind of time at home to now get the yard back together. So we were just thinking it's actually been nice. We've got our lights going again. We're actually redoing the grass, so it's going to be
Well,
all done by the
I've
time
been
that you
telling
guys are
everybody.
ready
I
to
said
come over.
when this is all done, or however we come out of it, I think a lot of people we're already getting a lot of calls. I mean, we've been staying very busy. I mean, I
Oh
can't,
yeah.
but I think people are like, okay, we've got to redo this kitchen. This kitchen is horrible.
Yep.
We got to redo this bathroom. This is just I can't take this anymore. So I think we're going to see a lot of remodeling work when this is all finished.
Oh,
Uh,
I'm sure.
yep.
Yep. Absolutely.
So, are there any books or
Absolutely.
podcasts you enjoy that you can share with for our listeners? Because I'd be really curious to hear
Yeah.
what you listen to or read.
Yeah, well, of course, I listen to yours, which I've
Oh,
absolutely
thank you.
loved. So I'm honored to be on this. But I do the TED Talks daily. Like
Yeah.
I find that one really good because it's all sorts of topics.
Right.
But of course, I've been following all kind of the healthcare technology
Sure.
ones, and a couple of really good ones just for general.
Uh
Like if
huh.
you don't want to get into in the details, is Andy Slavitt, who was the head of the Affordable Care Act. He actually has a new podcast called In the Bubble,
Hmm.
which is a really good one. And he's had all sorts of guests on that just kind of talk kind of what's happening on the front lines and how are we going to reopen. So that's a really good one. And then, trade-offs. There's
Yep.
a one called Trade-offs. It's health policy that's really good. And then, of course, our company just started one. It's called The Dish on Health IT. So I tend to, my
Cool.
podcasts, I end up listening to more of my work related, but, I always read kind of fun fiction books. So I kind of balance it that
There
way.
you
But
go.
those are a couple that I think people, that are listening that may be interested in learning a little bit more about what's going on kind of from the technology side
Yeah,
are
that's
really good
great.
ones to listen to.
That's great. Well, you guys stay healthy. We love all of you. Uh,
Thank you. You guys as well.
yeah, we'll
We're
get that.
looking forward to when this will be lifted, when
Yeah,
we can all get together
you took the
again.
words right out of my mouth. I was like, I'm looking forward to that day when we can come over and cook in that kitchen. So it's
Yeah,
going to be a lot of
absolutely.
fun. So, all right. Well, thank you for taking the time for doing this. Give everyone a big hug from the Candelaria clan, and you guys stay safe and healthy. Okay.
All right. Thank you so much, Mark. Take care.
All right. Bye bye.
Bye.
I want to say a big thank you to my good friends at Stockett Tile and Granite Company, where your project is our priority. The Stockett team, along with so many others, are wrapping up the final details on our demonstration kitchen at our new expansion of our Candelaria design offices. We have started our online video cooking classes, and our kitchen is amazing. I have had the pleasure of working with the Stockett team for nearly 40 years on some amazing projects, and trust me, they are the epitome of excellence when it comes to tile, marble, and granite. Work bar none. Their skill and customer service is impeccable, and the bottom line is they are just good people. I have traveled with, dined with, and just had good times, both personally and professionally, with Dave Stockton and his lovely wife, Becky, and they are the best. When it comes to your next kitchen, make sure Stockett Tile and Granite is a part of your team. Thanks for listening. We hope you enjoyed our podcast. We encourage you to write a review, screenshot it, and share it with your friends. Please instant message it to me and follow us on Instagram and Facebook. We thank you for listening, and we look forward to sharing more insights to inspiring living next week.